Give a spot diagnosis for this syndrome, clinical manifestation, how we will diagnose and how it will be managed. This child presenting since birth with prolonged direct hyperbilurbinemia. What's the diagnosis? Diagnosis is Alagille syndrome. What's Alagille syndrome? It is a genetic disorder, autosomal dominant, affect primarily the liver and the heart and other organs. It could be like new mutation, estimated to be around 1 in every 100,000 live births. With severe type of this Alagille syndrome, we can have severe heart disease and severe liver disease that it may need transplantation. It can be a life-threatening disease with a mortality rate of 10%, and the majority of this is due to heart complication or chronic liver disease. Clinical presentation, usually we have some many people with Alagille syndrome have similar facial features, including broad, prominent forehead, deep set eyes, and a small pointed chin. It is predominantly caused by change in the gene called JAK1, located on chromosome 20. The first one who described Alagille syndrome was Dr. Alagille in 1969. So this case was named after him. In 1973, Weston and Miller wrote about a group of cases with conjugated hyperbilurbinemia in newborn with pulmonary artery stenosis. In 1975, Dr. Alagille published his research on the full picture of the Alagille syndrome. To diagnose Alagille syndrome, you need to have evidence of bile duct paucity, in addition at least 3 or 5 major criteria. 3 out of 5. You need 3 out of 5 plus the bile duct paucity, cholestasis, evidence of cholestasis, characteristic facial features, vertebral abnormalities, usually they have butterfly vertebra, eye abnormalities, and heart defect. And most common heart defect they have is peripheral pulmonary stenosis. This is a narrowing of the pulmonary artery, murmur sometimes only. Any cardiac anomalies, although the defect typically affect the right side of the heart, like tetralogy of Fallot. To diagnose Alagille syndrome, you need to have evidence of bile duct paucity, in addition at least 3 or 5 major criteria. 3 out of 5. We need 3 out of 5 plus the bile duct paucity, cholestasis, evidence of cholestasis, characteristic facial features, vertebral abnormalities, usually they have butterfly vertebra, eye abnormalities, and heart defect. And most common heart defect they have is peripheral pulmonary stenosis. This is a narrowing of the pulmonary artery, murmur sometimes only. Any cardiac anomalies, although the defect typically affect the right side of the heart, like tetralogy of Fallot. Kidney, they can have renal dysplasia, renal tubular acidosis, and you can have mild renal impairment. Skeletal system, as we said, they have butterfly vertebrae, and in the heart, the most common, as we said, peripheral pulmonary artery stenosis. Ocular manifestation, usually the posterior embryotoxon and Axenfeld anomaly. So symptoms is yellowish of the skin, jaundice, in the white sclera of the eye, failure to thrive, small prominent chin, sunken eyes, frontal boosing, and broad nose. The color of the stool is light like clay. The absence of bile secretion in the stool, so it could be white stool. Urine is dark yellow in color. They can have large liver and spleen. High blood pressure possible due to cholesterol build up. Inability to absorb this fat soluble vitamin, which can lead to rickets and impairment of clotting. Eye problems could be in 75% of cases. Diabetes as a result of the failure of the pancreas. There is varying degree of mental retardation, could be normal, mild could be more. Small size testicle due to weak sex hormones. Kidney problems. And skeletal problems as we mentioned before. Cardiac problems as the murmur, confined murmur, and can present with complication of cardiac problem. Treatment for this syndrome. Early treatment is possible once the diagnosis is made. The treatment of Alagille syndrome typically involve medication therapies plus or minus surgical procedures. And all the medication aim is to improve the bile excretion from the liver, reduce the pain caused by the disease, and help improve the nutritional deficiency. Several medication used like orso. This medication differ in their rates of success. Other drugs are used for the itching that develop, such as cholestyramine and possible rifampicin, and also sometimes they can use antihistamine to reduce the itching from the bile. And also the patient may take benefit from vitamins like A, D, E, and K supplements because it's difficult to be absorbed and utilized. High calorie diet, very important, and they may need gastrostomy tube insertion to maintain high calorie intake. Surgery is common in more severe cases of Alagille syndrome for liver transplantation, and the patient may need surgical intervention. Cardiac intervention may be needed earlier. متلازمة العجائل. السبب الرئيسي للإصابة بهذه المتلازمة هو تحول في أحد الجينات، وهذا الجين مسؤول عن إبلاغ الإشارات بين الخلايا، أو تعطل هذه الإشارات يؤدي إلى أخطاء في التطور خاصة في القلب وفي الغناء الصفراوية، وأيضا قد يؤدي إلى تشوهات في العمود الفقري ومعالم الوجه. في هذه المتلازمة بيحدث زيادة في إنتاج الصفراء في الكبد، وعادة يكون هناك صفار من فترة الولادة، ويكون في الطبيعي لون البراز يكون فاتح مثل الصلصال لعدم وجود الإفرازات الصفراوية في البراز، وقد يكون لون البول أصفر غامق، قد يكون هناك تضخم في الحجم الكبد والطحال. تراكم الكوليسترول قد يؤدي لارتفاع ضغط الدم. عدم القدرة على امتصاص الفيتامينات يؤدي إلى نقص هذه الفيتامينات، وقد يؤثر في عوامل التجلط. أيضا قد توجد بعض المشاكل في النظر وفي الكلى ومشاكل العيون عادة تكون بنسبة 75% من الحالات. قد يحدث إصابة بمرض السكر نتيجة لفشل البنكرياس. كما قلنا أيضا إنه في زيادة في مستوى حمض الصفراء، وهذا قد يؤدي إلى حدوث حكة في الجلد، قد تحتاج إلى بعض العلاجات. أيضا قد تكون هناك عيوب خلقية في القلب، خاصة ضيق الشريان الرئوي، وقد يحتاج إلى متابعة طبيب القلب. بيكون أحيانا هناك شكل غير معتاد لعظام العمود الفقري، وقد يكون لها شكل الفراشة في 50% من الحالات، وغالبا لا تؤثر في شكل أو حركة المصاب. اصفرار الجلد، اصفرار العيون، الضعف وعدم زيادة في الوزن. العلاج لا يوجد عادة علاج معروف لمتلازمة الأجايل، ومعظم العلاجات تستعمل لتحسين أداء القلب والكبد والحد من آثار ضعف وظائف الكبد. من أساليب معالجة الأعراض هي الأدوية. تستخدم العديد من الأدوية لتحسين تدفق الصفراء وتقليل الحكة، مثل دواء الأورسودايول، أيضا قد يستعمل الكوسترامين والريفامبيسين، وقد تستعمل في بعض الأحيان مضادات التحسس، وغالبا لا تأتي بنتيجة. قد يحتاج أحيانا لبعض التدخلات الجراحية بسبب عيوب القلب، وقد تحتاج إلى تدخل للكبد، وقد تحتاج أحيانا إلى علاجات مشاكل الكلى ومشاكل العيون. وفي حالة فشل الكبد، وأحيانا إذا كانت الإصابة شديدة، قد يحتاج المريض أحيانا إلى زرع الكبد، وقد يكون هذا حل بديل عن المعالجة بالأدوية في الحالات الخطيرة من المتلازمة. قد تستخدم القسطرة لتوسيع الشرايين المتضيقة. ومن الأشياء الجيدة إن معظم الحالات تكون حالات خفيفة، ولكن توجد بعض الحالات التي تكون فيها العيوب شديدة جدا، قد تهدد حياة الطفل وتستلزم المتابعة والعلاج. توجد كثير من الأسئلة تسأل في بعض الامتحانات، مثل امتحان MRCPC والرابورت. What is the cause of xanthomas in Alagille syndrome? Usually the cause is severe high cholesterol, which lead to cholesterol deposition in the skin. سؤال آخر: What's the mode of inheritance? The mode of inheritance is autosomal dominant. What is the most common congenital cardiac disease? The peripheral pulmonary stenosis. How you can diagnose Alagille syndrome? Diagnosis by bile duct paucity and 3 out of 5 major criteria, which is cholestasis, characteristic facial feature, vertebral abnormalities, eye abnormalities, and heart defect. Other question: is Alagille syndrome always inherited? No. About half of Alagille syndrome mutation. Other question: are children with Alagille syndrome at risk for developing heart attack due to high cholesterol later in life. And the question, this is not well known. Is it can happen, but there is possibility, but it is not observed. It was not yet observed to be a problem. What's the most common renal abnormalities? Renal tubular acidosis. What medication to be used as ursodeoxycholic acid to improve the itching, and rifampicin. What is the most common characteristic facial feature? Prominent forehead, pointed chin, deep set eyes, and straight nose. Thank you. Don't forget to subscribe to the channel.